Welcome back to DBL. We're going to continue talking about Chadwick Boseman's surprising death from colon cancer. There's so many of you asking, how does it happen to someone so young, only 43 years old? Dr. Kohli, thank the Lord, joins us live. Dr. Kohli has helped us navigate the pandemic for the past several months, but now Chadwick's death is shining a light on a type of cancer that many Americans know little about, and Jeff, may I add, are a little embarrassed to talk about. It's hard to say, but I want that to normalize. So what should our viewers know about colon cancer, and can you talk about the risk for just the average American?
I'm so glad we're having this discussion, Tori, because colon cancer is the second leading cause of cancer death in the United States. And every 1 out of 23 males is going to catch colon cancer in his lifetime. Wow. And 1 out of 25 females. That's staggering. So if you think about 25 people that you know, 1 of them will get colon cancer. And as you pointed out, many of us are embarrassed to think about it, embarrassed to talk about it. And some of us have the perception that it's only a disease of old people. And what we're seeing is actually more and more deaths occurring in younger people. There are a lot of risk factors that are modifiable, so it's really important to understand what those are. So let's talk about those. So obesity, sedentary lifestyle, diabetes, smoking, eating red meat or processed meat, those are all risk factors that are within our control to modify our risk. Of course, there are risk factors like family history and such that are less modifiable, as well as our age, but it's important to know these. And finally, I want to make one last point, which is that Chadwick Boseman, who's Black, has a higher risk not just of getting colon cancer by 20%, but a 40% higher risk of dying from colon cancer because it's often detected later in the African American population.
Wow, wow, wow.
Doc, could you tell us more about getting screened for colon cancer, and when should people get tested, at like what age, I'm saying?
It's a great question, Jeff, because early detection is the difference between life and death. So if you detect it early, it's got a 94% survival. If you detect it late, it's only a 20% survival. Wow. So what the American Cancer Society is recommending is starting to screen people at age 45 if you have average risk. However, if you have a family history like Chadwick Boseman's family, then you actually want to either start screening at age 40 or 10 years before your family member was diagnosed. So in Chadwick's case, that would be at the age of 29 for his family members.
Now, talk about uncomfortable. I know we wanted to switch gears to the pandemic, but I kind of want to keep it here because I think it's important. Is this the same thing? I mean, let's just be adults here. Is this the same kind of examination where you have to go?
The colonoscopy.
The colonoscopy, right. I'm trying to keep it PG here, Doc.
Yes.
Yes.
Yeah, so there's 2 ways to get screened, Jeff, and they both have complementary roles. So colonoscopy is one. That's where you have to drink that horrible stuff to make you have diarrhea, clean out your colon, and they actually put a camera in the colon, the rectum, to take a look inside. That is the gold standard for testing, the best way to get tested. The second thing that they recommend doing in between your colonoscopies, which usually occur every 5 to 10 years, is to take a little stool sample, put it on a card, and check to see if you have blood in it, because a lot of colon cancers can cause blood to be in the stool.
And to just be super honest with you, if you notice, I know this is not going to be as PG as you want, but Katie Couric did a colonoscopy live on air because her husband died of colon cancer. To normalize this, if you are having different color stool, different types of stool, I know that's not normalized on TV, but we're going to say it.
No, because you have to have the conversation.
You do. Make sure that you talk to your doctor about it, that you're not embarrassed about it, because it's a, as she said, 94% survival rate.
And Al and I talked about it on the show as well. Like, we're going to go together and make it a thing.
That's
like
fantastic.
Tom Hanks and all those guys get together, Marty Short, and they all get together every year, and they have like the margaritas, and they get their colon checked.
That's amazing.
They make a little colon party out of it.
Colon party. Thank you so much for honestly normalizing this. Thanks for your facts. We know I'm watching right now, and a lot of you are writing in that you have family members, and we're thinking of you. Thanks, Doc. We'll be right back.